webinar. So we've done our webinar on the future of dentistry. And in this, we'll go over many different sections of, I guess, how dentistry could look in the next coming years. So let me go through. Yeah, just to introduce myself and Kenny, we've just, I guess, gone over this, but yeah. So I'm Jeevan. I'm just about to start my first year of dentistry at King's College London, and Kenny's about to start at the University of Manchester. So the first section we'll be going over today is the effect of the aging population of dentistry. So just to give a little bit of background information. So we know that, I guess, ever since 1950, life expectancy has been increasing quite a lot. So we've seen that from 1950, it was about 69 years, but today it's around 81 years. So people are living a lot longer. And on the other side, we also have the birth rates are declining. So in the 1960s, around 2.9 children were born per family. Now it's around 1.6. So we're seeing that although people are living longer, less young people are being born. So that's sort of creating a bit of a weird effect in the population where they're estimating that by 2040, 1 in 4 people in the UK will be over 65. So it's showing that the proportions of the population are going to change quite a lot. And it's being estimated by 2050 that among over 60s, tooth decay is set to double. So you're seeing almost 10 million cases of tooth decay, which is quite a significant amount. And if you look at the NHS as a whole, that's going to definitely put quite a big strain on the service. And I'll just go to the next slide to, I guess, going a bit further at the effects of dentistry. So as we know, if more adults are going to be living longer, more adults will be keeping their natural teeth. And not only will they be keeping their teeth, but the fact they're living longer, it means that there's be natural degradation of the teeth. And that will mean there'll be more prevalent diseases, more complex cases in patients. So there might be more gum disease. And as patients will be living longer, there'll be a greater chance that they'll be needing more complex treatment. So for example, crowns, bridges, and dentures. And that means that although there's more patients to treat, there's a lot more complex patients to treat as well. So that's a big strain on dentists and the service as well, as patients will be needing longer appointments, as well as needing a bit more care as well on the side. And as patients are living longer, they're more likely to have more chronic illnesses, for example, diabetes and cardiovascular disease. And that means there'll be more to treat of a patient as well. It's not just their oral health, but it could be their heart. It could be other things to manage as well. There may be other medications they need to be managing as well. And the last point I put is potentially the need for geriatric dentists. So to give a little bit of insight on what I mean by this is currently in dentistry, there's a specialty called special care dentistry. And that encompasses a very wide range of different things. So for example, people with special educational needs and also patients with cognitive decline, so Alzheimer's and dementia patients, which are typically elderly patients. But if we're seeing almost 1 in 4 people in the UK being elderly, there's going to be a greater prevalence of people with cognitive decline or chronic illnesses. So there might actually be a need for geriatric dentists, which is almost meaning that there might need to be a specialty just for the treatment of elderly patients. And that will definitely mean patients will need to, I guess, have more treatment in that sense. If I move on now. So if we look at how to structure an interview question about the aging population. So I've got a little example here, which is what challenges might dentists face in treating an increasingly elderly population? So I've got a little checklist of what I would do if I was answering this question. So the first thing I would do in this scenario is, I guess, pause and maybe clarify the question. Of course, now you can see it in front of you, but if you were asked this by an interview, it might just be, you want to quickly just go over the question a little bit, maybe say, just to confirm, the question is X, Y, Z, just so in your mind, you know what you're saying, but also you confirm to the interviewer that they also know that you're talking about the correct things. And then the next thing I would do is signpost. So signposting is so important in your interviews because you want to make sure that you're not just rushing into a question. You're almost having like a point evidence explain structure, and this is your point. You're talking about, so a key challenge is the increasing complexity of dental care in older patients. That's your signpost. You're talking about where you're going to be. So, and then you can give your background as well. So you don't have to talk too much about background because you're not expected to know a lot of detail, but I guess it's good to almost have a little bit of information on the side. So you could say, as more elderly patients are living longer with chronic illnesses, and then that's your background to your question of how there's complex cases. Then you can give your example. So for example, dementia can make oral care difficult due to memory loss and cooperation issues. That's your example. then you can add your experience. So experience doesn't necessarily mean you've seen this in person. This could also mean you've read an article or you've done even like a virtual work experience. It doesn't have to be a physical placement. It could just be anything extracurricular you've looked at or you've seen or you've studied yourself that can really tie into your answer and almost make it more personalized and tailored to you to make your answer feel a bit, I guess, well meant to you. So of course, as interviewers going to see so many different students, but if you can add a little bit of your own insight to this question, it just makes it a bit more memorable. Then I would also look at the implications. So the implications could be this pressures dental services, increasing training needs, and it may require specialties such as geriatric training. And then there's a reflection slash give a solution. So reflection is so important in your interviews. You have to be able to reflect about what you're saying, but also give maybe potentially a solution to your answer as well. So this could be something small. So I was thinking personally, so there's a part of dentistry called continuous professional development, and you'll learn about that a bit more as you go into your interview preparation in a bit more detail. So there's a governing body called the General Dental Council, and in that they specifically outline that all dentists need to undertake a certain amount of hours so that they keep in line with their training. So you could say that as more patients are going to be living longer, that could be encompassed as part of their professional training, that they need to look into more geriatric treatments. And then one thing I would finally always do is summarize and close my answer. You don't just want to leave on like a dead end sentence. You want to make sure that you almost give your little overview of your answer, just so it sounds a bit more formal and a bit more professional as well. So guys, now it is your turn. So I'll just put a little question here. So how do you think the aging population will affect the future of dentistry? So if I can have a volunteer maybe try and, I guess, have a go at answering this question, I'll give you a little bit of time to, I guess, prepare, maybe have like a minute to take to prepare for this. But if anyone would feel comfortable in answering, no pressure.
Maybe if we just get them to put hands up and we can pick someone so they know who they are before the minute. Before the minute.
Yeah, of course.
So anyone put your hand up, be brave, and we're not expecting loads. We know it's right at the start of interview preparation, but it's a really good opportunity to get feedback. And if you want, we can pause the recording as well. So who's going to be brave? Put their hand up. How do you put your hand up? Is that something that you would like to? Happy to take you, Bashir, if you want. Yeah, okay. So in a minute, whenever you're ready, really just unmute yourself and get started. So you can have about a minute if you want.
Would it be all right to start now?
Yep, go for it. That's brilliant. So, how do you think the aging population will affect the future of dentistry?
So, with the increase in Asian population as of recent, by 2040, there will be a large proportion of the population being older. As this comes into fruition, we can see that there will be more patients requiring dental treatment as well as more complex dental treatments. For example, during my time shadowing at NHS dental clinic, I was able to see for myself that there was a large proportion of patients were uh, that were older. So during this, I was able to see early signs of this problem becoming more prevalent in the future. During this, it can maybe make it harder for dentists to be able to carry that workload and can even affect the quality of treatment as well as the quality of dentist mental health. So although it is not confirmed if that will be the case, it could have a detrimental effect to dentistry, as well as also the opportunities for dentists to be able to gain skills required for the complex treatments like crowns, dentures, and even root canals.
Anything else you'd like to add, or should we leave things there?
No, but can I get some like feedback on the answer if possible?
Absolutely, yeah. So a really good answer, especially for someone starting out. So I'll let Jeevan and Ikin start with any feedback, and then I'll add anything. I was just taking some notes while you were answering. So feel free to go for it, maybe Jeevan, Ikin, whoever would like to start.
I'll start by adding that really positively you linked in your work experience, which is something that is always recommended to do. So you spoke about what you saw in your shadowing, which is something that not a lot of people actually do. So keep that work up. Always mention your work experience. You want to be in most of your answers where applicable, and that will get you points for your interview. So I think that was really good. But yeah, Jivan.
I like how there was a good structure to your answer. You didn't just jump straight into it. You signposted, you then gave a bit of background, gave your experience, gave an example, which I think is really, really good, especially so early on in interviews to try and have that structure already coming out. It didn't feel disorientated. So yeah, really good stuff for this early on in particular.
I feel like because I'm applying on a gap year, so I did have like previous interviews, but I wasn't able to get offers for them. So I feel like that's my main problem with the applications. So I'm not completely sure where.
Definitely happy to kind of advise what you might want to do differently. So for example, the way that you structured this was definitely brilliant. So you covered the idea of kind of more types of treatment, you covered the idea of sort of complex therapies, and you said that kind of an aging population effectively means a growing and a larger population, and a larger population of patients who are kind of in their later years of life will probably have kind of slightly worse oral health, as you know that kind of the incidence of cavities, decay, dentures is going to go up with age. So a larger population needing support, and you can link that back, kind of develop it a little more would be the first thing. So the points that you mentioned, each one of those points, relate them to your hot topical understanding. So when you say a larger population and a more challenging workload, you can link that back to what you already know about kind of the current state of dentistry. And so, for example, you can say that there are issues with, for example, recruitment and retention in certain areas. And we hear about dental deserts. So, certain parts of the UK that don't necessarily have the same quality of dental treatment and support. There's perhaps not as much access to dentistry, especially access to NHS dentistry. So, there might be the ability to get private treatment, but the NHS dentists may all have very long waiting lists. So, you can talk about a larger population needing more support and how that's going to perhaps worsen inequalities, how that's perhaps going to lead to more burnout for dentists. And if you are very specific about those points, not just saying harder workload, more mental health, but actually linking them back to your hot topics, that's very useful. Now, in some parts, you were already quite specific and you talked about crowns and dentures. I think that's very good. Some other stuff that you could potentially talk about. So you could try and link dentistry to broader health. Now, we understand that nowadays dentists are not just about the teeth. So we can talk about kind of the rise of age-related oral health issues. And you can talk about how stuff like diabetes, osteoporosis, even cardiovascular conditions, they can actually relate back to dental illnesses. So how they can lead to things like dry mouth, gum disease, oral infections, all of these areas as well, and linking them back to dentistry from that point of view. You can also talk about kind of if somebody has like neurodegenerative disease because they're older, maybe they have physical disabilities, are they able to kind of take care of their teeth as well? Are they able to brush? Will they remember to brush? And also thinking about kind of are they able to access the treatment? So is a lot of dental health advice online now? Are they able to access that based on kind of their older age? And also, are they able to physically get to the dentist? Do they need support to be able to do that? So that idea as well. And also, you want to think about kind of when you have a larger population that's living for longer, what does that mean in terms of prevention? So if the average person is living, say, 10, 20 years longer because of the advancements we see in health in general, what does that mean for what we need to do with teeth? Do we need to give more advice on prevention from a very early stage, encouraging children to brush, encouraging children to look after their teeth? Because now they have to kind of live for 10, 20 years longer with the growing life expectancy. And you can also perhaps talk about kind of changes in how dentistry is working. So we have a lot more focus on trying to do less invasive therapies. So rather than trying to replace everyone's teeth nowadays, we're trying to go for minimally invasive approaches. People are retaining their natural teeth for a lot longer rather than having stuff like kind of replacements, dentures, more so than in the past. And so we have a bigger focus nowadays on ongoing maintenance. And we can say how a lot of those things, and you did mention crowns and root canals, you can talk about like implants, fillings as well, and say how that is perhaps a lot more important nowadays compared to, say, what dentures were the main thing in the past. And you could even link it back to how stuff like the adoption of digital dentistry and technology, how that could make a lot of these things a lot easier. So really good answer on the whole, but in terms of what would next steps be, one is going to be kind of develop your points a lot more. So link them back to key ideas like larger population, like dental deserts and like the healthcare divide, like digital dentistry and advancements there, which we're going to hear about more from Jeevan in a second. And the other thing would be kind of mention these points in a good structure. So you can say to start with, I would say this is a good thing. The fact that we have a growing and larger population is a success for both medicine and dentistry, that we're able to have this, and that people are living for longer, but also living healthier lives with better teeth and not dentures. And then kind of have a structure. Firstly, I think this. Secondly, I think this. Thirdly, I think this. And then go into your conclusion and link it back to those 3 points. So overall, 1, 2, 3. And I think that in the advancement of digital dentistry, we might be able to cope with this rather well. So I hope that makes sense. We'll let you guys, Jeevan, Ikin, continue. And thank you so much, Bashir, for giving that a go.
Thank you for the feedback as well. Thank you.
Okay, so now we're moving on to dental technology, which is another really important aspect of the future of dentistry. And I'm first going to run through a few examples that I think you should note down and understand, because it would be really helpful to mention in some of your interviews. Okay. And the first one I'm going to mention is CAD and CAM technology, which involves, as I've said on there, computer-aided design and computer-aided manufacturing. Okay. Now, this involves using optical cameras and scanners and they take images of the teeth, and this will create 3D images for use in various aspects of dentistry. Okay. And to go through the process, which you could take a note of, I'll go through it quickly. First, the dentist will prepare the teeth, which involves cleaning the teeth, getting rid of any dirt, getting a clear image so they can get a clear image of the teeth, okay? And then the optical scanners are used, okay? So that's when the images are taken of the teeth, of every aspect and every area of the teeth, and they're stored in an online system. So, of course, all of this is really new, and it shows just how important technology is, okay? And then next is actually the design. So it's uploaded onto a computer and designed into a 3D image. And this is then downloaded onto a machine, which will then create the ceramic molds, which could be used for dentures and other applications like that. Okay. So that is something that I would really recommend just doing your research on it, because they're not going to ask a question, tell me how CAD technology works. But what they will ask are, maybe what do you know about dental technology, or tell me about the future. And this is something you can mention, because it will show that you've gone the next step and you've done your research. Okay. Now, my next example is Invisalign, which is something you all know, but I was looking at it from a different angle, because when people maybe mention Invisalign, they may talk about a new method of straightening the teeth, but remember, in these dental interviews, you're against the top candidates, so you really need to look at it from other angles, different angles. And I try to look at it from a mental health perspective, because braces, they straighten the teeth, but what's a big reason why people do not use braces? It's how it looks, is the pain and other stuff like that. And with Invisalign technology, of course, is not only, of course, a new method to straighten the teeth, but is actually increased accessibility to dental care and dental healthcare, because some people wouldn't take braces just because of how they look. Maybe they work in a specific environment where the braces could affect them. They feel embarrassed about it. Invisalign has fixed many of these problems. For people who could, although it is more expensive, for people who can afford it, it's meant that more people are actually going and getting their teeth straightened. And we always do say that a smile is one of the most important parts of a person's personality. So they're getting their smile and it's improving not just their physical health, but their mental health. So that's another thing to always try and do. Try and link up different areas and different aspects. So not just about the teeth, but how it is affecting someone mentally as well. Okay. Now, I think another interesting one to mention is stem cell technology. And this is another one that is something that might differentiate you from other candidates who may just know the quick examples, like they might talk about, oh, computers, online systems, but this is something that's actually highly specific. So I would take a note of this as well. And as a bit quick background onto how it works, it uses induced pluripotent stem cells or embryonic stem cells, which you may or you might be coming onto in your A-level biology if you take it. Okay. And what they do, these cells are used to produce another cell called aminoblasts. Okay. And these aminoblasts create enamel, okay, which is something that could be used. I mean, sorry, we know what enamel is, right? But this protein can be used to restore enamel. And an interesting fact is, for example, sharks, they can regenerate their enamel. So their teeth, they do a lot of, well, we know what they do. They do a lot of biting, right? But sharks can regenerate their enamel. We can't, okay? So this new technology can mean that instead of going straight to dentures, crowns, we don't need to do that anymore. And we could use these aminoblasts to create enamel and restore people's dental health in new ways. Now, this is very new and it's not something that's being used right now, but is something for the future. And I think what people are hoping is that it could be used in different areas of dental health. For example, for our gums, for our other areas for our jaw. Stem cells, literally, they're endless. The possibilities are endless of what you can do with them. So it is really interesting, and I think it is really important that you do look into what else stem cells could be used for and have your own ideas about it. Um, Now I am gonna quickly brush over AI. It was mentioned in the last talk, but AI is also used linked with CAD and CAM technology. So let's say we do have images of someone's teeth. Now we can use AI to speed up the process because they can review the images, help the dental professionals in trying to find out how you can help a patient better. So AI is facilitating, it's not replacing, but it is a good facilitator. And my point on the bottom is there are so many more facets of dental technology. It would take hours to talk about every new aspect. So do your research. The key to success is preparation. You need to do as much research as you can and know as many things that you can so you can stand out. Don't be the normal, be the person that your interviewee remembers, okay? Now, onto applying dental technology to your interviews. And I think I brushed this before, but they're not going to ask you, can you list the forms of dental technology that you know? That's a basic skill that you could have researched on the night of or on the day of your interview, okay? But they're going to ask you questions that take more skill where you have to apply your knowledge, okay? And it may not be clear that you even have to talk about it, okay? So I've put a few questions on here. One is, what impact do you think dental technology will have on NHS dentistry? What excites you about the future of dentistry? Okay. And in this one, it's not clearly said dental technology, but you could link it to what Javon was talking about earlier about the aging population. And you could talk about how the new methods, you're excited about the new methods that we're going to cope with the aging population. You could talk about the new technologies, some of those that I've mentioned before. And I put here that you may have to apply your knowledge to questions about work experience. For example, they might ask you, tell me about your work experience. So not even entirely linked to dental technology, but think about what you saw. If you shadowed a dental professional, think about what technology they used. So it is really important that this topic is learned because you can apply it in so many different areas, okay? So yeah, as I was saying, do not just give a list, right, in any question of what you know. So don't just say, oh, CAD and CAM technology, list how it works. There's it's always about applying it, okay, and linking it to what you saw, to your work experience, okay. So, for example, I put here, and I'll actually use my work experience, okay, because on my work experience, I actually saw a dental professional showing me, and he showed me the Invisalign technology and how he had a 3D image, and over many weeks, it showed how they predicted and used AI technology as well, and it predicted how the teeth would move over the coming weeks. Okay, now this is one thing that's very good. I've mentioned my work experience, but remember, you're competing for a place against top candidates already, so you need to go beyond this. Okay. So what I would say there is seeing this technology excited me and it pushed me to carry out further research. And that's when you could link in your stem cell. It pushed me to carry out further research on stem cell technology, where I saw how aminoblasts could replace damaged enamel in patients. Okay. So it's this thing about not just mentioning the dental technology, but you need to go beyond. You need to link it and you need to apply it to different areas. Okay. So yeah, now it is your turn, okay? And I really want you to focus on that linking, that just going beyond, not just giving a list of what you know, but li try and tie in your work experience, something you've seen, and what else you've researched in your own free time, okay? And as Ojals was saying before, we're not expecting you to know everything. It is quite early in your preparations, but just have a go and we'll give you feedback, okay? So what impact do you think dental technology could have or will have in NHS dentistry? And I see a hand up from Lalith. So do you want to have a minute to just prepare that answer?
So just whenever you're ready, Lalit.
Sure, yeah. Can I start? Hello? Uh,
Yeah, we can hear you. Yeah.
okay.
Yeah, just whenever you can start.
All right. What impact do I think dental technology will have on NHS dentistry? The research has shown that in the next 20-ish years, by 2040, 1 in 4 people will be above 65 years old. Older patients have much more complex and much more in-depth dental needs, which we need to be able to understand and accommodate. In my opinion, technology, especially advancements in fields such as AI, computer modeling, as well as stem cells, help us to make the treatment we do give more efficient, more accurate, and more helpful to the patients. This, in my work experience, I saw my dentist that I was shadowing, I saw him use computer modeling through x-rays and 3D scanning to mold a set of braces to a person's teeth. This interested me quite a bit because I wasn't aware of how much of the technology side is involved in dentistry. And so that prompted me to do more research into how modeling and AI is involved in this. Yeah, so I think dental technology is a rapidly improving field, and it improves the prospects of how accurate and how efficient dentistry can be as a field. Yeah.
Yeah, that was very good. I think yeah, all of us will again give a few talk about your positives and what you could improve on. I think, as I said, you took my advice. So you put in work experience, you linked on to what had led you to research. I really liked how you talked about how you were interested and how you saw how it modeled, and you mentioned stuff like that. That was really good. Okay, but to improve on your answer, I think you struggled on, you kind of ran out on what to say, which is normal, which is a normal thing. And what would help me at the start of my interviews is to, at the start of a question, is to kind of think in your head of maybe three arguments that you're going to mention in the question. Okay, maybe because your first point could be dental technology, just in that minute that they give you to prepare, if they do, you could say dental technology maybe is going to speed up treatments. That's one thing. Okay, dental technology is gonna improve the health of people's teeth. Okay, like think of 3 points, maybe four if you can, and then that will help you to keep it in a clear, structured manner. For example, in terms of speeding up, you could say, um, you could link it to your work experience. So you could say, on my work experience, I saw how the dental technician used AI to facilitate the treatment and analyze the 3D scan of a patient's teeth. And you see how if you've got a clear header, it's going to help you to actually link in the relevant work experience, because it's not always, although I said mention your work experience, you don't want to force it in all the time. Okay, so just try and keep, it'll help you to keep a structure, because you weren't that structured in your argument if you have the key headers that you're talking about.
Yeah, I completely agree with Ken, you're right there. I think you had a really good initial structure when you first started going, because you gave your little bit of introduction, then a point, and then I liked how you linked it in with, for example, the aging population as just something to sort of give on. But I think where you could improve a little bit more with that question is with the reflection side of it. So you've mentioned a lot about how the technology will improve efficiency, but try and reflect a little bit more on that. So how exactly will that improve efficiency, and what benefits does that have if efficiency is improving? Because you're talking about how the age population, so 1 in 4 people will be over 65, and you mentioned it's efficient, but give a little bit more into that. It's not just about what you know, it's all about how you can talk about it, how you can apply it to different things. And I think you had a really good structure at the start, but it sort of drifted off a little bit. And I think Kenny's point was really, really good with, I guess, in that little bit of time you have, try and give yourself three arguments. You don't have to have a fully polished answer, because as you speak, you will naturally get into the conversation, the bit of a flow of it. But if you give yourself almost a couple of points that you can speak about before you go straight into the answer, it will make sure that your argument's a bit more organized and you can give a bit more of a full rounded answer. But overall, well done.
Definitely. So strong answer, and I do concur with everything said so far. I think to start with, so we begin with your introduction. I think you definitely had, I would say, a good structure, but remember the content of your introduction is important too. So what I felt a little bit like is what you started off with came across a tiny bit scripted. So as you got into the middle of it, it became very natural and started to flow. But the stuff you started with came across a little bit scripted, and it wasn't really directly relevant to the rest of your answer. So your introduction shouldn't be kind of rephrasing the question in almost like somewhat empty words. It should be just you saying, well, these are the main points I want to talk about, like one, two, three, and four. And so exactly like I think Ekeni was talking about before, you could have like a list of a few points. So you could have like, firstly, I think it would really improve access and efficiency and all sorts of things like teledentistry, AI helping with triaging, deciding who to see first, technology helping with bookings, record systems, so remote consultations, how that's going to improve access. And I think it's really important in your introduction, you address the question. So don't just rephrase it. Don't just say, this is the question, but actually analyze what's being said. So the question is asking about NHS dentistry. You have to actually say specifically, what is the state of NHS dentistry? So yes, aging population is one of the things there, but also struggling to find dentists in certain areas of the UK. Struggling to get access to appointments, dental deserts. That is the issue we're facing. Now, this is how I think dental technology is going to solve those problems. And then go through your points. So, access and efficiency, teledentistry, AI, how we can actually make the clinical care better. So, how we can do all of these cool new therapies like stem cell therapies, like gene therapies, also stuff like digital imaging, CAD CAM. AI in treatment planning. So like you have your point number one, access and efficiency. Point number two, actually kind of improving clinical care. You could have point number three, talk about like workforce support. So how we can maybe supervise dental hygienists and therapists remotely, how we can automate routine tasks, how we can help with stuff like charting, help with stuff like taking notes. Now, a big thing, if you're talking about your work experience, be very specific. So I know you said you saw technology in your work experience, but say exactly what you saw. So, for example, a big issue we face right now is that a lot of dentists' time is going on taking notes, dealing with admin, routine stuff. And that's not what dentists want to do, right? They want to see patients, they want to provide treatment, they don't want to do admin. And that's a huge issue we're facing in terms of burnout. So, dentists not enjoying their career, not enjoying the work life balance because there's so much admin involved. So, when you talk about AI in dentistry, when you talk about technology, not just the cool, glittery stuff, but also stuff like how we can help with admin there, how we can help with, say, taking notes, making appointments, how that can make life easier for both dentists and patients. And you could also talk about kind of prevention side of things, because prevention in public health is always a big thing. And you might want to make one of your points. So, like, first one about access, second one about enhancing care, third one about helping with workforce and burnout. And when you expand your first point, you could even talk about stuff like patient experience. So you could say, like, how can we provide online resources for patients to educate themselves, like digital education tools, videos, websites, and also stuff like, say, prevention. So we've got like wearables and apps. How can we have wearables and apps that help patients to like keep track of their dental hygiene, giving people reminders on their phone? They have wearables that say time to brush your teeth, time to floss, stuff like that. So that would be my introduction. Make sure it's not scripted, it's very specific. Completely agree with all of the stuff that Ekeni said and Jeevan said about work experience. Very good to bring in, but this is not a question like tell us about why you want to study dentistry. This is not a question that has to be fully about you. So the main thing has to be driven by these other three or four points. Now you're not going to have seen everything in your work experience, so go through the three or four points, and where relevant, definitely bring in your work experience. So, like I gave the example and I linked it back to dentists getting burnt out, or aging population, or access to dentistry. But don't just talk about your work experience, have a defined structure. These are the things I'm going to say, and then link it back to your work experience as you go through. But if there's stuff that's not been seen on your work experience, still talk about that too. Don't just say, this is what I saw in my work experience, the end. So I hope that makes sense. But yeah, my two big points of feedback would be a little bit more general, list like three or four points, and make sure you talk it about NHS dentistry. So when you're analyzing the question, always be linking it back to what's being asked of you, not just what does technology mean.
So when you're talking about the NHS dentistry, you'd say it's good to start by talking about problems that they're facing and then specifically how technology will help improve those problems, right?
Definitely. So that is your introduction, right? So instead of just rephrasing the question, your introduction is, I know that NHS dentistry is facing these problems. Now, don't just mention random problems, mention problems that you think technology can fix. So these are the biggest problems. This is what I know is an issue in the NHS right now. And I think technology is a fantastic solution because we can do number one, two, three, and four. And then you talk about your four things and you can link them to your work experience where it's relevant. And then you say that overall, I think technology is brilliant, but your conclusion can be like, there are downsides. Like, for example, we might see more digital inequality because elderly patients, low income patients might not access telehealth services. We might have issues with like the ethical side of things. So, use of AI, is that fair across all groups? Is it accurate? Are there the right data protection safeguards? And even like it's going to cost a lot. How are we going to buy all of this AI and scanners and CAD CAM stuff? There's a huge NHS budget constraint right now. And even like when are we going to train the staff to do all this stuff? So like summarize your conclusion. These are the things we can do. I think it's amazing, but there are these barriers that I'm very much aware of.
Thank you very much. Yeah, that makes sense.
You're very welcome. And like I said, this is the kind of feedback I give to somebody who's just about to sit their interview. Keep in mind that you're still doing the UCAT and hasn't even started your preparation yet. You're doing brilliantly, both Lalit and Bashir so far. So don't worry at all. I was just trying to say like everything I could think of to help you the next time this question comes up.
Okay, so the next section I want to quickly go over is the focus on preventative care and how, as dentistry evolves more, this would definitely be something that's going to be emphasized a lot more. So the first point I really want to go over is the idea of prevention over treatment. And this is meaning that as dentistry goes further, we don't really want to just be giving patients treatments. We want to make sure that they keep their teeth for longer, particularly as the population is seen to age a lot more. You don't want patients to be in the cycle of restorative treatments, because as soon as a patient has a filling, that tooth is never going to be the same again. As soon as you start drilling a tooth, it's never going to be the same. And it will just be a gradual cycle of treatment until that tooth eventually goes. So one thing that dentistry is particularly focusing on is the idea of more frequent appointments and also a greater emphasis on patient education, doing as much as possible to make sure that the whole patient base as a whole has access to understanding how to maintain their oral health, but also to benefit themselves as well. So you see this a lot more in investment in community and outreach programs. For example, in London, they do a lot more to go over different areas and underserved places. So Odes mentioned earlier about dental deserts and how in particular regions, patient access and patient education is just not seen as much. And for example, I know with King's College London, they have a society called the Smile Society, and in that they go see children who do not have access to patient education. And some of them who are even 9, 10, 11 years old don't even know how to simply go over simple oral hygiene means. And it's so important as future dentists and also dental students to make sure that you understand how to, I guess, be more in, I guess, have a proper understanding on how we can use preventative care to mean that patients as a whole in the future will eventually have better outcomes as well. And you see this a lot more with the integration with a wider multidisciplinary team. So dentistry at the moment is seen to be a little bit isolated, but of course that's not really true in the grand scheme of things, because your oral health is connected to all parts of your body. It's connected to your cardiovascular health. It's connected to so many different parts. And it's not just whatever happens to your mouth is unique. It's important to make sure a patient's treated as a whole. And particularly with the aging population, patients are going to come in with a lot more chronic illnesses. So for example, neurodegenerative disorders or cardiovascular disease. And it's important that dentists can interact with GPs or consultants and make sure that care is overall as a whole. And even just in the dental network itself, it's important that, particularly with gum health, so you have dental hygienists and dental therapists, which are a lot more responsible for the maintenance of gum health and the maintenance for oral hygiene. And it's really important that that whole network is working and communicating really well with each other. So you can see even with a couple of these little images I've got here. So brush properly, use fluoride toothpaste. This is an example of a public health campaign that dentists and dental public health specialists can use to try and make sure the population is a bit more aware of it. But you could also link this in an interview in particular to barriers to care. And it's really important to not just talk about what's being done, but what could be done better, what could be done more as well. Because it's quite true that in particular areas, for example, dental deserts, this education isn't seen as much. And particularly NHS as well, where patients can't afford private treatment, and then NHS dentistry is a lot more difficult to access as well. It's important that these campaigns are made, because if a patient can't access a dentist, it's important they still have some sort of access or some sort of knowledge that they can gain. So this is something that is really, really important. Okay, if you have anything else to add with this slide.
No, I think you covered everything, yeah.
Cool. So I'll just move on to the next one. So here we have our interview top tips and everything that I guess we sort of want to give it as advice to make sure that you're all fully prepared.
But yeah, our first point, as you said, is prepare, okay? I think people often get really scared of interviews because it is daunting. And confidence for your interviews does come from preparation. And don't worry about the questions we asked you here, because you as Ojas was saying, you've got 4, 5 months or 4 months, 3 months until interviews actually started. So you've got time to prepare. And for a question like the one on dental technologies, what you would do in your preparation is you could go home, and what you shouldn't do is be writing a word for word answer for your answers for each question, or you're going to sound scripted, which people can notice, it is really obvious. But what you can do is put the points that you would mention and maybe some facts, maybe the work experience that you're going to mention for each question. And that's going to help you so that if you do come across the question, you're going to know what points you can say at the start. Because at some interviews, they don't give you time to prepare. So you have to know the points off your head. You have to be quick with it. So by going through loads of questions and going through the points that you would say for each question, it will help you to keep your answers structured. Another thing in your preparations is try and do as much talking as you can. It's not preparation, just learning the facts, learning every single stat. Because when you get to the interview, you won't be able to say it. The best way to get used to speaking, to stop stuttering, for example, and be able to answer questions quicker is just to keep speaking. If you've got friends, family, try talk to them. Try do as much preparation as you can, and it will help you.
Just to quickly add to that point as well, one thing I found that really helped me is, in particular, is almost sort of have a camera and just record yourself speaking, because then you can give feedback to yourself of how you talk, and you'll quickly notice, am I speaking too quickly? Am I stuttering too much? And you'll be able to pick out key little things that you can improve on as you go. So it's not just, if you don't have access to actually talking to a person, you can just record yourself and give yourself feedback. So that's another quick little tip I have just to mention.
And I've got another little tip linked to what you were saying. I mean, if you want to go even further, what I would do is when I was recording myself, I would have a picture of a man on my screen. And I mean, that's if you got no one. And trust me, I put a picture of someone who looks quite scary because on your interview, not everyone's gonna be the nicest person, okay? And it's just little methods like that that are gonna help you with your nerves, most importantly, so that all your preparation doesn't go to waste in your interview.
Definitely.
Definitely would
So,
agree. Sorry, do you even go for it?
oh no, I was just going to be on to the next point, but go for what you were saying.
I was just gonna say, even if you guys like can't access mock interviews and stuff, and I mean we do run those, but if like you can't find somebody who is from a dental background, like a dentist or a dental student, just ask anyone. Because for a lot of these questions, okay, like something like dentistry and technology, fine, you need a bit of specialist knowledge. But the lots of the questions are like situational judgment style. You're being asked, somebody gives you a high value gift, how do you respond? A patient adding you on social media, how do you deal with that? Or like give an example of teamwork, communication, leadership. Why do you want to study dentistry? Why do you want to study at this university? It's still going to be useful to do a mock interview, right, with them, because they can still give you feedback on how you're communicating, the delivery, the structure. And so, even if you can just like find a friend to practice with, maybe there's a friend at school, and like at my school, I think I was the only one to get into medicine. But like, imagine somebody else was doing medicine, somebody's doing dentistry. It doesn't have to be someone who's doing exactly the same as you. A friend, a teacher, a parent, and just get that practice talking to someone. So even if you can't get a mock interview, obviously the extreme option is have a photo of somebody scary on your screen. Maybe that's a good idea. But if not, then just talk to literally anyone, and it will still be better than not doing anything else. And start now would be my top tip. As soon as like UCAT is done, the more practice you do, the better. So there's no need to do hours and hours. Just start talking to people, start practicing.
Definitely. So I think the next point I'll go over is stay calm. I know it's so much easier said than done, but genuinely, your interviewers are not out to get you. They just want to get the best out of you. And it's so important that you just take a breather or you just take a quick moment to, I guess, sort of be in the zone a little bit. Because if you start getting a bit nervous and anxious, you will end up babbling, you will end up going a bit too waffly in your answers, and it will end up showing. So it's really important that even if during your answer you feel a bit anxious, just take a moment and genuinely pause, because your interviewers will find it so much better for you to just take that moment to yourself rather than you just waffling on in your answers, because then that overall just shows the quality of your answer is not there. So if you do honestly find yourself getting really nervous during your interviews, just genuinely take that moment and pause, or even ask your interviewer, can I just take a moment? And it will be a lot better for you in the long run and the outcome of your interview as well. So for
Yeah,
the
so
next point as well. Oh, sorry,
yeah,
you go.
the next point is I've mentioned this a lot before, but try to tighten your work a bit, but don't force it, okay? As I just was saying, when it's relevant, mention your work experience. But there should not be an interview that you haven't mentioned your work experience at all, because there's so many instances that you could mention things you saw. For example, if they ask you about qualities such as teamwork. You could talk about the communication between the dentist and the dental nurse. For example, you can mention your work experience in many different areas. So it's really important to mention it because they might not have your personal statement in front of you. So they don't know if you've done work experience. So it will help you if you mention that. And moving on to the next point, reflection. And Javon did go over that before, but again, reflection is the most important thing in an interview. Reflection is not just saying what you did again, it's saying what you learned from your work experience, what you learned from what you saw, what you learned from your research, and how it's affected you. And when I was reflecting, I would always say what's pushed me to do further. So maybe your work experience, as I said before, has pushed you to do research. Maybe it's pushed you to learn a new skill. You always need to reflect on what you've done. And sometimes what I would do is reflect on how you could improve yourself. So if I was talking about a time when I've showed good teamwork, maybe in a restaurant, right, as I'm a waiter, I could say, I didn't do this great, but looking back at it, what I would do next time is this, or what I've implemented to prevent that from happening is this. Because they want to see if there's people who can look at your mistakes and not just feel bad about your mistakes, but who can turn around and say, I can make this better, because that's what you have to do as a dentist. It's not just going to be the same work every day. You're going to make mistakes, and that's what builds you as a dentist.
Definitely 100%, because the interviewers know you're not a perfect person, but you have to be able to talk about your shortcomings, but not just mention that I did this badly, but talk about what you've gained from it and how you can improve. It's almost like you'll hear about the what's your biggest weakness question, which is quite a big one that floats around. But with that, it's not about, oh, this is my weakness. It's about how can I reflect from this and how can I improve? That's something that you should definitely focus on, reflection in your answers. And the next thing I want to go over is pause and clarify your question. So at the start, do take that moment. Don't just rush straight into it. I know I've mentioned this a lot, but you don't want to come across as someone that's just jumping straight into your answers as well. And another thing that I haven't written down here, but honestly, you need to make sure you do this, is address the question directly. Don't change the question to something that you want to hear. Actually address your answer. It's not about preparing so much that you have these rote answers, because you might get the why dentistry question, but not directly, but in an indirect way. It might be hidden as something else. And it's not about you just changing the question to make it what you want to say. It's about answering the full question as a whole and reflecting fully and making sure that you give the full answer. So that's something I'll definitely go over. And another thing is close off your answers as well. Do not just end on a blanket statement, because the interview doesn't even know that you finished your answer. It's just you have that 5 seconds of silence and it's like, okay, we're moving on now. But try and, I guess, give a little bit of a summary or in your reflection as well. This is why it's so important to have good structure for your questions, but just make sure you give a little bit of a closing off to your answer so the interviewer knows that you are done now. And also it feels a bit more conversational with your interview as well. And finally, please smile in your in your interviews. Your interviewers are not scary people. And I mean, they might come across scary, but they're not actually trying out to get you. They want to make sure that you're not just a person that is so academic or is so good at a UCAT exam. They want to make sure that this is a person that can actually treat a patient, is someone that can actually talk to a patient. Because in the grand scheme of things, when you're actually a dentist, when you're actually a doctor, patients don't really care that you got 3 A stars over 2 A stars. They care about, can this person actually treat me? Can this person actually talk to me? Can they hold a conversation? Which is obviously so important. And that's what the interviewers really want to gauge from you, because they know you have the academic ability. They know you have the UCAT exam. They know that you have the perfect personal statement and etc. and references on paper, that you have these amazing stats. They want to know that as a person, you have the ability to actually talk to a patient. And that genuinely is what sets you apart from other people. That interpersonal skills is what really makes you different to everyone else. So please just make sure that you take a little bit of consciousness to present yourself in a good way, so an interviewer knows that this person has the ability to actually communicate effectively with the patient as well.
Okay, so I'm sure Ojas can add a lot to this slide, but as I was saying before, getting into dentistry is hard. You've got about a 10% chance of getting in, and you need to remember that the people you're competing with, they're not just normal people. These are people getting A stars, top level students doing lots of preparation. I mean, I used to see in my interview people holding huge folders of all their preparation. So you have to be the best, you have to be the top, which is why we run many different things with my UCAT. Right now, you can look into by scanning that QR code. We run the one-on-ones, which is, as Ojas was saying, you could get, as said many times, you can either get mock interviews, which is really helpful to brush over your skills, helps build confidence. You could go through specific questions and maybe tackle a specific area. And they can also be one-on-ones about receiving information. So maybe you want to learn more about the future of dentistry. Maybe you want to learn more about, it could be like dental vacation, stuff like that. So that is really useful. And as you see the guarantee there, we do also run a dental program, which isn't if you check in the next few weeks, it should be ready on the website. And if you do carry out this program and you complete it, we will offer you a 100% refund if you don't get into one dental or medical school, depending on what you're doing. Okay. And that's how confident we are in our skills. We've got tutors from different schools, from every different school. And last year we had a almost 100% success rate. So we do recommend that you do look into this.
Definitely. I would honestly recommend my UCAT so much. It's been so helpful throughout my entire application, not just because it specializes in interview in particular, but it goes through the entire journey with you. As you will realize in the next coming months, when you actually send your UCAS application, there'll be a whole strategic application guide as well. And it's currently on the website for last year entry, but that was honestly so helpful for me in choosing which universities were good for me to apply to, because it's not just about where I want to go, it's also about where can I make sure that I have a higher chance of getting in? Because if my UCAT wasn't good enough or some sort of statistic wasn't the best on paper, I know that I still have an option, and it's really important to have that. And yeah, I would absolutely recommend my UCAT so much. So please do scan the QR code, go on the website, and look at all the different things available to you guys. And I'm pretty sure most of you, if not all of you, will be involved in the group chat session. So you will understand already how many different parts of information that you have access to. So yeah, I would definitely say take a look at my UCAT, and it'll be really helpful in particular for your entire application.
Thank you so much, Juven and Kenny. The only thing I can potentially think of, so yeah, guide will come out very soon. So that will tell you exactly kind of where you should apply based on your stats strategically. Now, I know Kenny said 10%. What I would say is it does vary by university. So don't get too scared as well that like you're gonna really struggle. What I would say is that depending on where you choose to apply, especially some of the unis with higher UCAT cutoffs, they have very good post-interview chances. So, for example, if you had a high UCAT and could apply to KCL, they give offers, and this is kind of from last year's guide. You can wait for the new one, but they give offers to over half of the people who attend interview. And somewhere like QMUL, Bristol, that have quite high UCAT cutoffs. But if you do get that UCAT and you can apply somewhere with higher post-interview chances, that does then mean that your chances of getting an offer are quite high. But at the same time, others are quite low, so in line with kind of the 1 in 10. If you think about kind of chance of getting an offer, obviously after you get the interview, the chances get better than that. But definitely there are some with slightly lower chances. Either way, kind of, if you prepare, don't see it as kind of if it's a 10% chance they're going to just give me a 10% chance of rejecting me. It's about picking the best applicants, right? They're not just getting a random number generator. And if you do exactly what they're looking for, you structure your answer well, you reflect, you don't have to have cured cancer or done anything insane like that. It's just have a good structure, reflect, smile, be a good person who they'd want to become a dentist in the future, get along well with them. And even if one station that doesn't happen, remember it's usually MMI. So even if one station goes badly, don't let that affect you in the next one. You can always kind of have your progress separately assessed in each one. Will the strategic application guide have graduate dental schools? Well, there are only three of them, UCLan, Aberdeen, KCL. And I guess KCL has two courses for dental medical professionals and otherwise. But yeah, I'll include those three for this year. Either way, like graduate entry dentistry is gonna have to apply either some medicine or some undergrad because there just aren't four graduate dental schools out there. Will we help people choose unis? Well, yeah, that's kind of the point. If you read the guide, you can choose your unis. Will there be an updated guide? Yes, definitely. What else have we got? What's the best way to prepare for interviews when juggling A levels and mocks? So, Ekeni Jeevan, how did you structure it? I'm guessing like interview prep before your interviews and then A levels after.
I mean, I'll go first then. Uh, so I mean, what I did. So I did my UCAT August time, mid-August, and then after that personal statement, I got that done near the start of September. Because I focused on my UCAT, then did my personal statement, and once I got my personal statement um done, I went on to A levels and interview because my first interview was in November. Okay, so what I did, I had exams in the start of September, so I would always try and do at least if I, of course a few hours of A level, but I'd always try and do initially 2 hours. I know it seems like a lot, but 2 hours of interview prep a day, and this was in September, right? Because you want to keep and by sometimes it was just reading a book that I had gone over. It's not always speaking to someone for 2 hours or doing a bit of research, but I did that initially, and then once I got closer to interviews, you need to remember that yes, you need to keep prepping for your A levels, but you need to get the interview first, and A levels are at the end of the year, while interviews can start from November time. So I stepped up and I did more interview prep than A level prep. I still kept, you always want to be consistent with A level prep as well, but I was focusing on doing as much interview prep as I could. As I said, if my parents were sleeping at night, I'll get the picture of a man on my screen and I'll even do that as well. So I kept doing as much as I could. And when I got closer, I was doing interviews in school as well. So in my free periods, I would see if you've got friends doing medicine or dentistry is really helpful if you can all speak all in a group, have a go practicing answers in school as well. And that's really helpful because you can get different perspectives. That's another thing I did through October to November and through the whole interview season.
So yeah, I would say I had quite a different experience with interview preparation and A levels, mainly because the school that I went to is a very, very small school. So I was the only medical or dental applicant as well. So it was quite hard to find similar people doing the same thing as me. So it did feel a little bit isolating at first, but in terms of juggling interview preparation at A levels, I sort of had it all kind of crammed at the same time because my KSL interview was in the middle of my A level mocks. So it was very much like okay, what do I prioritize here? But I think definitely prioritize the interview at that point, but do not forget about your A levels at all because you could have all of your offers with interviews, but if you do not get the grades, it doesn't really matter because either way, we'll have to redo the year anyway. We would have to go over it again anyway. So I would say when it comes to your hot points for your interviews, make sure you get your priorities straight there. And I think, like Kenny said, about starting interview prep as early as possible, that's definitely the best thing you can do because it's not sort of about rushing it towards the end. It's interview preparation is very different because it's not about a specification you learn. It's about building up those skills and communication skills over a large period of time to try and make sure that you come across well because you can't really cram how to speak to a person because it just doesn't really make sense like that. It's all about building your interpersonal skills and getting feedback as a whole. So I would say from effectively now or after your UCAT exam or after you sent your or after you finish your personal statement, try and get ready on that interview preparation and make sure that you're kind of building them skills. And then when you get to your hot points for when your interview is about a week away or 2 weeks away, make sure you focus on a bit more. But I think also make sure that your A level preparation is not being hidden in front of that or it's not being neglected because you need to make sure that your grades are also on top as well because you can have the offers, but if you don't get the grades, then it's just not going to work out.
I think it really depends on you as a person as well. So what we have to be very careful of is like if I think about what I did personally, I was predicted kind of for a star, and when it got to September, I was like, right, let's focus just on interviews now. And so, well, actually, I had BMAT at the time, so it was first let's focus on BMAT, and then let's focus just on interviews. And I started to think about A levels probably in the next calendar year. So, like, we had A levels in May, and I started to think about them in like January, February, that kind of time. But the thing is, it really depends on you. Now, if you're super confident that like you've got A levels sorted, then you can leave it a bit later because obviously mocks how you do doesn't matter. It's just a way of assessing your progress. The only exams that matter are the ones at the end. if you're talking about January mocks, that is. But for other people, you might find that you're already a little bit behind with your A levels and you're kind of borderline at an A or at an AB. In that case, you can't neglect your A level preparation. If you miss your offer, that is a much bigger problem than if you don't get into dental school this year. Because if you don't get to dental school this year, all you need to do is kind of repeat UCAT, repeat interviews. You still can apply anywhere you want. If you don't get your offer, you can still apply, but the universities that accept reset are quite limited. And it's also going to be quite tricky to try and reset your A levels on your own without the support of school. So don't neglect your A levels too much, try and keep a balance. And in fact, I was doing the data collection for last year's medical interview program. Over 99% got offers, but a small percentage did then miss the offers at the end. So, like, at least at my UCAT, that was the bigger risk. Everyone was being helped with interviews, but just have a think about where you are for A levels. Don't totally lose track of your A level preparation, and you can always try and keep a balance of the two. So maybe right now you're more focused on A levels. As it gets to October, you're more focused on interviews, and then as soon as you've got maybe one or two of your interviews out the way, again go back to being quite heavily focused on your A levels. People are asking where should we apply for med as a fifth choice. So Kenny, you went for Manchester. I have a list here of universities that could definitely be good options. So, for example, Plymouth and Bristol. Sorry, we're talking about medical schools for dental applicants. So Sunderland, Brighton and Sussex, Sheffield, Bristol, and Plymouth. Those are good options. And also Manchester tends to be a good option. People have been getting offers. So Sunderland, Brighton, Sheffield, Bristol, Plymouth. The only reason I was a tiny bit more worried about Manchester was they've stopped using the non-academic information form for medicine at Manchester, but it seems like they're still not looking at personal statement. So these are the sort of options you're looking at. Definitely you can apply to both. Kenny has applied to both. If you're on UCAT experts, Angel got into both, but the other way around. So Angel did like Plymouth Dentistry as a fifth option and got 5 offers. It definitely can be done. If you're doing graduate entry, it just depends. So some of them still have minimum A-level requirements. Some of them then don't. So you can check university by university. But either way, what's being used in shortlisting would be the A-level, the degree classification. And that's not just for graduate entry dentistry, that's also for the normal 5-year course. So usually the bigger focus would be on the degree classification. You can see their pages are strategic guide, and also there's the Medical and Dental Schools Council. If you don't want to do medicine, is it worth applying as a fifth? I think for the interview practice, potentially, but you can also leave it blank if you want to. Or you can consider
Could I
something
add?
like dental hygiene and therapy.
Could I just add? Yeah, I do recommend not leaving it blank because I was first fully set on medicine, but my dentistry interview was my last one, and the amount of preparation that I did and experience I got from doing 4 medical interviews, it meant that by the time I got to my dentistry interview, they asked me a question about something I didn't even really know. I'd only done a little bit of research on, but because I was so confident, I was able to work it well. So you should never really turn down extra practice because it's basically like getting a free mock interview. You're getting a free practice, and I mean it will be stressful, but honestly, I would definitely not recommend leaving it blank. If you can put it as somewhere you can get free interview practice, see it that way.
I
I'm
100%
definitely a
agree with that.
huge fan of applying to both. I don't think many other companies actively push it, but definitely I've seen so many people getting both. Even like 5 offers, but also maybe if somebody's only getting 1 or 2 offers, and that's like a really nice safety thing. That say you've got a low borderline UCAT score, and then not many dental schools you can apply to because the number of dental schools is quite limited. The UCAT cutoffs are all clustered together. Or you can always apply to, say, a few dental schools that are good for low UCAT, like, say, Dundee, like Liverpool, like Belfast, low UCAT friendly. And then you can apply to some of these medical schools, like Sunderland and Plymouth, which are low UCAT. So even like applying 3 and 2 would be a valid option, 3 dental, 2 medical. If there are literally no options with your UCAT score, at least it means you're getting 5 interviews rather than putting something that just doesn't make sense. Say you have a low UCAT and you go for KCL dentistry, probably not going to work, So you might as well put something that's a medical school and get the interview practice.
I 100% agree with that. I would say, especially with a medical/dental application, do not leave any of your application spaces blank. Even if you know 100% I'm not doing medicine, still, as Kenny and Ojas were saying, it's still an interview practice that you can have. It's still experience that you have of having in that interview frame. Even though you know that you don't want to do this, it's still preparation that it's still going to be beneficial in the grand scheme of things. So do not leave any of your spaces blank, or don't do a course that you know is not going to be for you. Or I would say do medicine over biomedicine if you know that you don't want to do biomedicine.
How much above the minimum UCAT score for each uni would make the option safe? So the thing is, if we knew what the cutoff was, then just that score. Like if Manchester has a certain cutoff, if you get that score, you then get an interview. So you don't need to be above the minimum. The only thing is we don't know the cutoff. Even the university doesn't know the cutoff until you guys apply. Because the cutoff depends on who applies and like who is the lowest UCAT scorer of the say 100 people getting interviews. So if you compare to the minimum cutoff for last year, if you try and aim like maybe 10, 20, whatever you can above in the guide, obviously the higher above the cutoff, the safer you are. Now, like last year, a lot of dental schools went up by quite a bit again. And I think, for example, Birmingham Dentistry went from say 2780 to 2870, so almost 100 up, and lots of others increased quite a bit as well. If you're a little bit above the cutoff for last year, it would help. But again, if you're just not finding options, then at least apply the place that you're safely on or above the cutoff. Try not to apply too many that you're well below the cutoff. Do you know what Newcastle Partners was? So they've not yet released for 2025 is the thing. Hopefully they will very soon. What do you do if predicted grades are low? Unfortunately, not many dental schools. Cardiff doesn't care about predicted grades, but the vast majority do. So it's either like Cardiff or foundation years you're looking at. But like medical schools, there are options for low predicted grades. Quite a few of them don't look at predictions. So like your medical school options are more numerous. For dental schools, it's only really Cardiff and foundation years with the wrong prediction. So convince your teachers, try and explain to them that look, I've got this UCAT score. I have been improving. Feel free to give me another mock, but I think I deserve higher than this. Actually make a case for improving your predictions. How much more leniency do you get with achieved grades? It's not necessarily leniency. A small number do give you preference with achieved grades. So, for example, Cardiff for dentistry, you get extra points in the shortlisting. And number of medical schools like Leicester, Exeter, also give you extra points for achieved grades. But besides that, it doesn't really make a difference. You have to do the same interview, same UCAT.
I was just going to make a quick point, guys. For anyone talking about resets or information, please do check out the strategic application guide for last year entry, because a lot of information will still be quite similar. Maybe not for cutoffs, but just leniency on interviews and post-interview cutoff rates, because that doesn't typically change that much, because that's more set by the university and how they choose to go for things. So even though it might not be completely up to date, it's still a good guideline to go off, and it will help inform your choices as of now.
Definitely. So, like people talking about resits, as you can see for dentistry, there are definitely options even if you're resitting your A levels. So like Bristol, KCL, Sheffield, Plymouth, totally fine with 2 resits. Manchester fine as well, but only issue being you then need to get an A star. So it might be a slightly bigger challenge for you, but definitely there are options even without extenuating circumstances. And I know there are a couple medical people here as well. So medical as well, lots of options at like Reset, no disadvantage, Aston, Bristol, Edge Hill, Sheffield, Southampton, Hull, York. So definitely options. Is it better to start interview practice after receiving interviews? For reference, like one of my KCL ones, they gave me 10 days notice and it was on the 24th of November. Now, if I started practice then, it would be quite stressful. So I would say, as long as you've applied strategically and you think you'll get interviews, don't leave it until actually getting the interview. Start earlier than that. What else?
I just saw a question as well that said, how do you link medicine work, how do you link dental work experience into medicine interviews? It doesn't have to be very specific. It's not just about this work experience specifically for medicine and dentistry. All work experience is good work experience. It doesn't have to be you were in a hospital. It could literally be me working as a sales assistant in a shop. Any sort of customer facing role, any sort of thing that you've observed, as long as you can reflect on it and talk about what you've learned from it, that's beneficial for any type of interview. Don't think you need to have that hospital shadowing experience. Although it's beneficial, it's not a game breaker. It's not a challenger for your interviews. It's really important just to talk about what you've learned from something and your experience from it. It's not specific about what you've done.
Yeah, because I mean, I applied for both, for example, and I wasn't able to get much work experience for dentistry, but as Javan was saying, mention other things you've done. If hopefully you have like a part-time job. I mean, care home is actually a good work experience to do for both dentistry and medicine because it's something that you can really talk about for both. So that's the one I always mention. I mention in both. And I had a job as a waiter, but I think I mentioned that in every single one of my interviews about it was a question about how I made a mistake. I said like I dropped a plate or something, but I reflected on it. So it's more about they don't really they do care about your work experience, but they more want to know how you reflected on your work experience and what it's taught you, not just someone who just says, "Oh, I did this linked to dentistry." If there was one person who just mentioned one that was in a care home, but they reflected on it versus someone who didn't, they're going to choose the person who reflected on it, and that's what I did, and it helped me to get into both.
Yeah,
Completely
definitely.
agree.
This is something that I saw when I was at my KCL open day, and I remember the dean talking about how they had a student talk about how they've observed this amazing surgery and they've seen this. But there was also a student that talked about how they had a part-time job in Sainsbury's, and in that they had a lot of customer-facing experience. And although you might think, oh, wow, this person's observed these neurosurgeries, but at the same time, they don't really have much to say for it because they've said they've done it, but they don't have much to talk about from it or what they've learned from it. But from having that customer facing experience, you talked about how you deal with difficult people, how you would be in different scenarios, the fact you've had to be in professional circumstance. There's so many different things and so many skills that you can gain from that. It's really not about what you've done in particular. It's just about how you can talk about what you've learned from it. And that's ultimately what is so important for your interviews. So that's the one really big piece of advice I'd have.
Completely agree. I think there are two aspects to work experience or volunteering. The one more important aspect is how you can link it to skills. So stuff like communication, teamwork, leadership, skills that a dental professional has to have. Can you relate yourself and your experiences back to those skills? And for stuff like that, absolutely you can do, say, your part-time job in, say, a shop, in a supermarket as a waiter. Those are very, very useful and probably more so than just passive shadowing. That is the main thing that they're looking for. Now, usually they're not going to ask you, have you shadowed any dentist? That's not necessarily a requirement. What might be useful is that there's a second kind of experience you could do just to know what a career as a dentist is like. And if you want to answer a question like, why do you study dentistry? For a question like that, it might be useful to have an insight into what a career as the dentist is like. Now, for that, what I would say is you don't have to have in-person experience in a dental practice. That's totally fine if you don't. What I would look at is some of this online stuff. So, like, we have Discover Dentistry from Sheffield Dental School. And this is like a free online course. It goes through like some online dental work experience. I definitely recommend going through something like this and just finding out a little bit more about it as a career. That will help you with stuff like why dentistry. And there's a similar course run by Glasgow Dental School, again, free online. And if you have a part-time job and you can reflect on your own skills and you find out a bit more about dentistry with a course like this online, you'll be totally fine. So, like, people are getting five and they're not spending weeks and weeks in dental practices, you will be okay.
Yeah, I've seen a question saying, "How do you link Dent Wex